I'm Dr. Kemp Clark. I'm currently the president of the American Association of Neurological Surgeons. We have begun a project of taping distinguished men who have contributed richly to our specialty, and I'm privileged today to be talking in Phoenix with Dr. Loyal Davis. Dr. Davis has had a long and distinguished career in neurosurgery and in American surgery, and I'd like to ask Dr. Davis to give us something of his background and how he got into medicine and how he got into neurosurgery.
Well, Dr. Clark, I'm glad to be here with you. And I was born in a small town in Illinois, Galesburg, Illinois, which is a division point on the Chicago-Burlington-Quincy Railroad. My father was a locomotive engineer. And he often walked home with a neighbor who was a professor of Latin and Greek at Knox College. And I finished the 3-year course in high school, had shorthand typewriting, and of course was headed for some sort of a position with the railroad company. But I think Professor Drew made an impression on my father and certainly on me, and I went back for the 4th year in high school, and then Professor Drew arranged for me to have a scholarship at Knox College for a year. But then I went to Chicago and went to work for the railroad and typed letters which went out to people telling them how to go to Denver and take trips on the railroad and so on. You could just sit there and close your eyes and type. And one day the passenger traffic manager, an old Scotchman, wore half glasses, came to the door and there were no women in this office, all men, secretaries and people. So he came to the door and said, "Come in here." I went in and he gave me a letter. And I took it in shorthand, and it had to do with the moving of a theatrical troupe through Galesburg. Well, I knew Galesburg and the yards and everything, and he had it messed up so that the cars were in the wrong position, and I changed it and took it into him, and finally he came to the door and really was pretty mad. Called and said, "What did you do?" And so I explained it to him. Well, he accepted it. Well, I served as his secretary then for a couple of months, and finally in about January, I decided I wanted to go back to college. Now, I had my first friend, the very first friend I ever had was a young lady. And she was raised by her grandmother. Her father died. Her father was a doctor in Galesburg. I never knew him, never saw him. And her mother died shortly after she was born. But Grandma Taggart would speak to me when I'd go out to take her on a date or something about her son, the doctor. Now, in this railroad office that summer was a young man who carried himself with a great deal of dignity. I don't know his name to this day, but he went to the Harvard Medical College, they told me. Huh. And his appearance and Grandma Taggart came together for some reason, and I decided to quit the job, go back to college, because I wanted to study medicine.
And go to medicine.
Yeah. And I told my father about this, and because I would go down and have dinner with him when he came in off his run. I was the only child. My mother was 8 years younger than he, and was easily upset. And he listened and he said, "Did you quit or were you fired?" And I said, "I quit," which made all the difference in the world to him, you see.
I'm sure it would.
Oh, yes. Yeah. And then he said, "Well, I'll tell your mother." In other words, he would settle her down. And so I went back to college and then entered Northwestern Medical School with many conditions. I hadn't had enough college work to meet the requirements. And so, but there was no admissions committee in 1914. Just one man, Mr. Patterson, who was the registrar, the admissions committee, and we had a class of 60, and if there'd been one more, we'd have had 61, you know, because he looked at us and decided whether we'd come or not. So I went to medical school for 4 years, graduated from Northwestern. And then I took an internship at the Cook County Hospital and went back to Galesburg to practice with an older man and one of my classmates. And that didn't work out very well. And finally I decided I would like to call Dr. Knavel and see if I could be educated and trained to be a surgeon with him. There were no residencies in Chicago then. And the only way you could be taught and trained to be a surgeon would be to be with an older surgeon who wanted to take you on.
Truly an apprenticeship.
Yes, exactly so.
One-on-one teaching.
That's right. And I went up to Chicago. He interviewed me shortly after finishing an operation in his operating room where he had been. And then I went back in September, and he took me over to Dr. Ranson's laboratory. And so I spent the first year, entirely the first year, helping in the gross anatomy laboratory with the freshmen to dissect and help as much as I could. And then Dr. Ranson gave me a project because Dr. Knavel said, now after you have been through your education and training, you, in the meantime, you should choose some field of surgery about which you may know more than another field. You just make a choice.
Even at that time, he was thinking of subspecialization in surgery.
That's right. That's right. And so, because of my relationship and doing well with Ranson's course in neurological anatomy, Percival Bailey, I suppose I said, well, I'd like to maybe do neurological surgery, because there was not a neurological surgeon in Chicago then, no one who confined himself, his practice to that.
Is that right?
And that's right. There was just no one. And there, of course, no residency. Well, in the second year, I would go over, and of course, Dr. Knavel did operations on the brain and trigeminal neurotomies and peripheral nerve operations with his hand surgery. And on those patients, I would examine them and write my note about them. But I was not in the operating room, except as an observer, and still working in Dr. Ranson's laboratory with the students. Now, the third year, then I became the resident and operated with him. The fourth year, then he arranged for me to go down to the Brigham with Dr. Cushing.
Dr. Knavel is, I think, known most now for his work in hand surgery.
Yes.
Yet I believe he was a member of the Society of Neurological Surgeons.
That's right. He was one of the original members of the Society of Neurological Surgeons, a very good friend of Howard Nafziger's and the men of that generation.
Could I get you to tell us something about your experiences with Dr. Cushing and your time at the Brigham?
Well, yes. When I was at the Brigham, Dr. Bailey was there. Ken McKenzie was the resident, and he was followed by Tracy Putnam. And Norman Dott was there as I was as a, well, they called us a voluntary assistant, you know. And the first day that I went to the Brigham, I sat in the stands and watched him operate upon a patient. And after he had finished, I knocked on the door of his dressing room, and introduced myself, and he said, yes, I know, Knievel has written me a letter about you. All right, make yourself at home, and dismissed me. He didn't tell me what I was to do or anything. And so I got a hold of Mackenzie and said, you know, what do I do? And he said, well, you just have to figure it out. So I went around and examined patients. I knew how to do that without insulting the patient or making any difficulty. And I wrote up my notes and put them on the chart. Mm-hmm. And then one day he called me in. This was, maybe I'd been there 3 months. I'd see him in the hall, he wouldn't even speak to me. I'd say, good morning, Dr. Cushing, he'd walk right on. And this time he had a bells rang. Well, no one told me I had a certain bell ring. And one of the nurses on the C ward said, my goodness, why don't you answer the bell? I said, what bell, you see? And finally, I went down, and his secretary said, well, he wants to see you. So I went in and stood in front of his desk for, a good 5 minutes. And he had a lot of books out on his desk in front of me. And finally, he looked up and said, sit down. And I sat down. Now then, he had a patient's chart in front of him, and I recognized that I had put some notes on that chart. I didn't know who the patient was, but I had from him the most interesting and thorough lecture and discussion about multiple sclerosis that you could imagine, referring me to the books that he had in front of him, and this went on and on. Now, I had made a diagnosis of a spinal cord tumor, and then when he got through, no, it was the other way around. I made the diagnosis of multiple sclerosis, and he thought she had a spinal cord tumor, and had been referred to him, the patient had been referred to him by Dr. Taylor. Well, when he got through, he said, now you see where you're wrong? And I said, I'm sorry, sir, but I don't. I've done the best I could, and that's what I think. Now, when you take out the spinal cord tumor, then I'm wrong. Well, I thought he was going to kill me. And then he began to search in his pocket for a cigarette. And he smoked Herbert Territons. Now, when I think about it to this day, that I carried Herbert Territons in my pocket, hoping that sometime he would reach for one and wouldn't have one, and I could offer him a cigarette simply to say hello, and well, I'll smoke one of your cigarettes. Well, I took out my cigarettes, and he took the package, took out a cigarette, and put the package in his pocket. That was the first time we got into that I had a real time with him. Another time, then he said, why aren't you operating with me? And I said, well, I've worked with Dr. Knievel, and you haven't said anything about this. And he said, well, I want you to take over C ward, and you operate with me when I operate upon a patient from C ward. Well, one Saturday morning, he was working, and it was rainy outside, and it was the day of the Yale-Harvard football game, and of course, I'd always wanted to see a Yale-Harvard game. And I was scrubbing up, and he said, are you going to the game today? Well, I almost blew my top. I said, no, sir, I don't rate the Yale-Harvard game. Well, he said, And I said, I'm operating with you. He said, I've operated without you for a long time. Go down and get the tickets and go to the Yale-Harvard game. Well, so I left the scrub sink and started to the door, and he said, have you got rubbers? And I said, no, sir. He said, how do you expect to go out on a day like this without rubbers? Take my rubbers. I started again, and he said, have you got a heavy raincoat? I said, no, I've got a raincoat. He said, take my raincoat. And I went to the Yale-Harvard game. Ducky Pond was the Yale captain. This was in 1923, the fall. And he scored the touchdown that beat Harvard 6-0. Now, in the second, between the halves, the man came around and said, give me your ticket stubs and sign them. And here I was with a ticket that belonged to Harvey Cushing. And if I signed Loyal Davis, was Harvey Cushing going to get into trouble, or how would they explain that I had it, you see? So I forged Harvey Cushing's name and then didn't enjoy the second half because I was so worried, concerned, and left the game early. And I went back to the Brigham, but he wasn't there, so I had to wait till Monday and walked in and said, I've enjoyed seeing the game, but I'm afraid I did something wrong. He said, what'd you do? So I told him. He laughed. He said, I wish you'd have signed Loyal Davis. I've been waiting for just that opportunity to tell him that I have a right to do whatever I want to with my ticket. Well, these are...
When did you return to Chicago then, back to Northwestern?
Yes, and started to practice.
And started to practice. Was the Passman Hospital built then?
No. Passman Hospital had been in existence, but it had closed. And Passman Hospital was not opened until reopened until 1929. Mm-hmm. And so I was at Wesley Hospital on the south side where Dr. Knavel was. I was adjacent to the medical school then. And so I waited for a patient.
Was it long coming?
Not too long, because Dr. Knavel kind of
looked out for
me.
In neurological surgery, what procedures have you found to be most rewarding from your standpoint as a surgeon? What's your favorite operation?
Yeah, well, there's no question about that. I was always, I got a great deal of satisfaction and pleasure out of sectioning the sensory root of the fifth nerve for trigeminal neuralgia. And I suppose it was the anatomical approach that really appealed to me, you know, and the technical steps in doing that. And I think that gave me the greatest pleasure. I liked the spinal cord surgery. But as I look back at it now, intracranial surgery, we didn't have very much to work with. Mm-hmm. We had metal clips, the Cushing clips. Mm-hmm. And then finally Bovie came out to Northwestern, and we had the Bovie unit. Mm-hmm. And I brought back from Boston the suction of blood,
yeah.
You know.
What would you say was your least favorite operation, which is the one that gave you the most trouble when you ever went to
Well, I wish that I'd never attempted it. You see, I had worked during this time with Lewis Pollock, who I went over to the county, and he would examine patients. He educated me in neurology, really, mm-hmm. and then we did our research together into cerebral rigidity and so on. And then came the time about what might be done about Parkinson's disease surgically.
Mm-hmm.
And that was ill-conceived as far as I was concerned, now looking at it. And I wish that I hadn't even done one operation for that disease.
What did you do? What was the procedure?
Well, we did a craniotomy and you know, attempted to isolate the basal ganglia and make a lesion in the basal ganglia. And on one side, you see, and then see what happened, and if necessary, we do the other side. Well, then Pollock and I did almost a total sympathectomy on a patient with Parkinson's disease in order to see if we could affect the muscle tone. Well, we couldn't. And, but those operations I wasn't very happy about.
I know you've had a long, distinguished career as a surgical educator. Would you give us what your philosophy of neurosurgical education should be today?
Well, I will. I'm glad to. But I think that whoever is listening to me has got to understand that this is based upon my experience. As I said, there were no residency programs in Chicago in surgery. You were taken on a one-on-one basis by an older man. But I think, and have always felt, that a man who wishes to devote himself to any specialty in surgery, neurosurgery, no matter thoracic surgery, whatever it is, should have a very sound basic education and training in the principles of surgery. All of the principles and facts about surgery which apply to any surgical specialty. And then that should be the major part of his education and training. And the minor part should be, after he's had that, should be his education and training in the specialty in which he's interested. Now, obviously, I think that in neurological surgery, the man should have some education in the principles of neurology and be able to make a decent neurological examination and attempt to make a good diagnosis. And I think that's true in thoracic surgery. I think he should know how to examine the lungs, and almost every special field of surgery, but I think it should be based upon an education in the principles of surgery which apply to every field. And I sometimes am a little disturbed by the education which is reversed, so that, well, you don't need very much knowledge about the principles of surgery. You know, you float through that as an intern and then go right into a surgical specialty. And I don't agree with that. I think that the education and training should be based, and as we were talking earlier, I think that anyone who speaks about surgery to young men should always speak about their education and training, not just say he's going to be trained as a surgeon. He's got to be educated in the principles which apply to surgery, in my opinion.
What sort of advice, counsel would you give a young man now starting out in neurological surgery? Would you suggest to him that he begin to concentrate on one particular field of neurological surgery, for example, vascular surgery? Would you suggest that he develop a research interest? What sort of things would you tell him?
Well, I think that he should have an interest in research, anatomical neurology, physiological neurology, whatever appeals to him. But he should carry on, or clinical research. He should carry on a project, a research project, first of all. I think in this day and age that, as you just suggested, there are fields in neurological surgery to which he may devote himself or know more about than other fields of neurological surgery. I think that's true. I think that he should have an interest in neurology and in being able to examine a patient neurologically and not be dependent completely upon referrals from so-called medical neurologists. I think he should know enough basically to make the diagnosis and decide whether he thinks that the patient is a surgical patient or not.
In other words, you're reflecting what Cushing said, that the neurological surgeon should be his own neurologist.
Yes.
A good measure. Did he take out the spinal cord tumor and prove you wrong?
No. He called in Dr. Taylor, who came over and examined the patient and said the patient had multiple sclerosis. Now, he didn't say anything about this. He didn't say to me, well, Taylor came over. I saw the chart, obviously. I want to see what Taylor had said. There it was. And of course, you didn't say, well, you didn't take out that tumor. But the patient was then discharged from the hospital, and nothing was ever said about it. But that was the best lecture I ever had on multiple sclerosis. And this went on for an hour and a half or 2 hours. I just sitting there. This is a one-on-one education to me of why this patient didn't have multiple sclerosis and had a spinal cord tumor.
Let me ask you one other question. What is your perception of today's medical student as compared to the medical students of, say, 15, 20 years ago? I know that you had a deep interest in undergraduate education when you were the chairman of the department at Northwestern. Several of my friends have told me about the famous interviews with the professor of surgery in his office in his senior year. How do you feel about them now?
Well, I don't think that the present day student is as dedicated to the study of his profession as his predecessors were. Now, there are exceptions, of course.
Sure.
I think that you have to look like a surgeon as well as you can. And that means, at least in my book, that you answer clearly, look sharp, and try to be alert. I don't think that I don't think that the student should go along with the customs of the day if he's going to be a doctor. Now, I think that, well, when I was a student, I had one suit of clothes. I'm not talking about having fine clothes. I'm talking about being clean, having a necktie on and a shirt. And I tried to insist upon that with the students when I would meet the freshman class, the entering freshman class each year, introduce myself, and then ask each one to get up and give me his name and where he came from and what college he went to. And there was one lad, one year, when I walked in, he was sitting there with his feet up on the chair in front of him, reading a newspaper, and just a shirt open, and he just wasn't a medical student for me. And I asked him his name and said, now, if you want to come into this class and be here, you've got to have a necktie and you've got to have a coat on and you've got to be clean. And you're not clean. Your hair is not well groomed. So I wish you would leave. Well, he got up and left. Never said a word. And there was just dead silence, of course. And so we went on with the introductions. And in about 15 minutes before we'd finished the introductions, he came back and caught me in between students and said, may I come back into the class? He had a coat on, he had a necktie, his shirt was clean, his hair was brushed, and he sat down, introduced himself, and I stopped and said, now where do you live? Well, he said, after I live over on the west side. And I said, you didn't get to the west side and back in this short time. He said, no, sir. I said, where did you get the coat and the shirt? He said, from the fraternity house. I said, okay, you'll do. You'll do. You'll do, you see. And I'm sure I embarrassed him, but it set a tone, and he was a good student. But I've always tried to because that's the way I was taught, I suppose, that's why, and to look like and act as well as you can as a surgeon. Because surgeons, to me, you see, are a special group of medical people. And when something happens that makes me feel differently, I feel rather badly about it. I really do. Kind of crazy to think that way, but that's the way I feel about it.
I think of no finer place to stop the interview than that. Thank you very much, Dr.
Well, it was a great pleasure. Nice to be here. Very nice.
We all appreciate it very much.
Thank you.
Thank you.